Presiding Officer, yesterday this Parliament agreed to suspend former Health Secretary Michael Matheson for attempting to misuse £11,000 of public money. And rather than defending Scots and protecting the integrity of Parliament, John Swinney chose to put his party before the country. Had this been at Westminster, Michael Matheson would now be facing a recall petition and potentially a by-election. But yet again, the SNP holds Scotland to a lower standard and believe it's one rule for them and another rule for everyone else. And while John Swinney spent all of his time this week managing his party and defending sleaze, waiting lists in Scotland reached a record high. Now over 840,000 Scots are stuck on an NHS waiting list. More than 1 in 10 have been waiting more than a year. Why is John Swinney putting the SNP first, not Scotland?
First Minister.
President Officer, I'm the first to acknowledge that we face challenges in the National Health Service as a consequence, as these issues have been well rehearsed in Parliament, of the aftermath of COVID and the implications that's had on the amount of time that people are having to wait. And I'm sorry for the amount of time people are having to wait for treatment. We are reducing the longest waits and we are making headway in that. In relation to the volume of activity within the National Health Service, the statistics this week indicate an increase in the level of activity within the National Health Service to begin to eat into those long waiting times, which I accept are far too long for too many people. But the steps that the Government is taking through the investment of £30 million in the Waiting Times programme, the establishment of the National Treatment Centres, which are already making an impact in this activity and which are producing some of that welcome level of increased activity, combined with the focus in the National Health Service on tackling the longest waits, are the measures the Government is taking forward to ensure that we tackle the legitimate issue that Mr Sarwar raises with me.
Anas Sarwar.
Presiding Officer, waiting lists are going up in Scotland, not down, and I think John Swinney has to get his head out of the sand. Because every day John Swinney spends putting the SNP before Scotland has consequences for our NHS. Consequences for patients like Natalie from Glasgow. In 2017, Natalie had emergency surgery for a brain tumour. In 2021, she began to feel symptoms and specifically pain around her eye. She has a tumour around her optical nerve, which is causing her pain and pushing on her eye socket. In December last year, she was told she would need surgery and part of her skull would need to be removed and not replaced. She has heard nothing since. A brain tumour, and she's heard nothing for almost 6 months. And she's been told she could lose her sight if not treated. She told me this morning, that just makes the anxiety and the concerns worse. I'm worried about the pain being an indication that the tumour is getting worse, but I have no way of knowing. I'm in the dark and feel completely alone during all of this. So does the First Minister understand that patients like Natalie should be his priority, not defending a failed health secretary who attempted to misuse public money?
First Minister. The first thing I would say is to say to Natalie, I understand entirely the anxiety that she faces, and I'm sorry that she's not heard anything since December. And if Mr Sarwar, in the aftermath of today's exchanges, would like to advise me of the details, I will take the issue up as he would understand I would do. Let me say also that patients like Natalie are my focus. I'm spending a huge amount of my time as First Minister focusing on the real and legitimate concerns of people in Scotland about our public services. I said to Parliament last week that my priorities would address the challenges in our public services. It would be one of the 4 major themes, along with eradicating child poverty, the transition to net zero and the stimulation of economic growth. Those reforms and developments and progression in our public services will be at the heart of my priorities, and they are. That's what the Cabinet was talking about in the course of our meeting this week, and we will continue to do that. So I assure Mr Sarwar and I assure Natalie that the concerns of people in Scotland of getting access to healthcare treatment when they need it and at the earliest possible opportunity will be fundamental to the priorities I take forward on behalf of the people of Scotland.
Anas Sarwar.
Officer, we hear the same answer week after week, month after month, year after year, and things keep getting worse for people right across the country. And I've heard what the First Minister said, but it doesn't change the fact that he has spent the past week fighting for Michael Matheson when he should have been fighting for patients like Natalie and hundreds of thousands of Scots like her. And after 17 years of this SNP government, 1 in 6 Scots are stuck on an NHS waiting list. Our NHS desperately needs change. In 1948, we created our NHS. In 1997, we rescued our NHS. And on July 5th, the 76th birthday of our NHS, we will begin the process of rescuing it again. But that also needs change in Scotland, because the priorities of this SNP government are all wrong. Why is John Swinney more interested in defending Michael Matheson than defending our NHS? Why is John Swinney putting his party before the country? And why is John Swinney failing NHS staff and NHS patients every single day?
First Minister.
I reiterate that my primary concern is to make sure that people like Natalie receive the treatment they want at the earliest possible opportunity to address the anxiety and the acute health requirements that they have. And again, if Mr Sarwar would give me the details, I'll attend to that after First Minister's questions. But I have to say, some of the rest of what Mr Sarwar then went on to is just a little bit hollow. Wes Streeting, the Labour Shadow Health Secretary, said this on Wednesday morning: "The NHS is in crisis in every part of the United Kingdom because the decisions that are taken in Westminster don't just affect England, but Wales, Scotland and Northern Ireland." Earlier in the month, he had said, "All roads do lead back to Westminster because of the austerity that we've suffered for 14 years. Now, in relation to that austerity programme, Rachel Reeves, the Shadow Chancellor, has indicated that the Labour Party, if it's elected to office, will not increase income tax, or national insurance, or corporation tax, or VAT, and that it's accepted very strict borrowing limits within very strict fiscal rules and very strict tax rules and squeeze spending budgets. What that amounts to is austerity on stilts from any incoming Labour government. And if that wasn't bad enough, Wes Streeting said yesterday that he will hold the door wide open for the private sector in the National Health Service. He will hold the door wide open. He went on to say, "We will go further than New Labour ever did. I want the NHS to form partnerships with the private sector that goes beyond just hospitals." So don't give me the stuff about the anniversary of the National Health Service. Labour's preparing to sell us out on austerity and the National Health Service and can't be trusted to deliver for the people of Scotland.